start our recording. And yeah, my name is Angela, and I know we must have had so many virtual sessions together, but just briefly introducing myself for people who might be joining us newly. I'm Angela, and I work here as a project coordinator, basically with the GYA team. And it's been amazing and interesting period as well for me to, get the opportunity to hear how GYAs are passionate and making efforts in their own local communities to ensure challenges towards access to education are well resolved within their communities. But yeah, talking about challenges and access to education, our session or the series Understanding Inequalities in Education is practically a way for GYAs understanding that the GYA program is basically like a program with over 2,000 young people across 140 countries. So challenges, issues in global education, they all differ across the geographical region, across countries, across communities, and how these manifest, and also the solutions that they profile within these communities are quite different. So we thought about a session whereby GYAs will have the opportunity to come together to discuss the challenges that they're experiencing within their communities, particularly when it has to do with education, and then focusing on the Act for Early Years campaign, and also talk about the solutions that they are bringing in within their own communities, and also for GYAs to have that broader, wider view, if I would say that, to be able to adopt or adapt these solutions within their own communities. And we've had this session for quite some time now, and today we'll be focusing on maternal health in early childhood development, basically to discuss and understand how maternal health impacts early childhood development, both in the aspect of cognitive development, physical development, the academic achievements of children as well. And with that said, like I mentioned previously, we're going to go through some session guidelines in terms of what we'll be doing today and what you would expect to see. We would have facilitator who is Shazia, and also we'll have panelists also who will be here to discuss their experiences in that aspect of maternal health in early childhood education. And I would say also, please feel free to turn on closed caption if that is needed. And I would appreciate if you all stay muted while our panelists will be presenting, and also, if you do have any question, the chat box is the right place to put in those questions, because we will have a question and answer session later during our session today. But with that said, I'm really happy and glad to hand over to our facilitator for today, Shazia, and if you're able to take off the mic from me now. Thank you.
Thank you so much, Angela, for all those details. So, without further ado, I would like to dive into today's session. So, hello, everyone, and welcome to this important session on maternal health and early childhood development. And I'm Shiza Hirani, GYA from Canada, and I'll be your facilitator today. So, we're so glad that you're here today. And remember, this is a space where your voices, questions, and experiences truly matter. So now, before we really ground ourselves in the session today, let's take a moment to understand why this session matters and what maternal health in early childhood really is. So just a session overview for you guys. Today we're exploring the critical connection between maternal health and early childhood development. So we'll see how improving maternal healthcare doesn't just impact mothers, but it also kind of shapes the future of our diverse communities, and it promotes gender equality for all. It fuels economic growth and lays the foundation for children's cognitive, physical, and emotional well being as well. And so we'll also learn from our incredible panelists who work on the ground in different parts of the world, and you'll actually get a chance to ask questions and share your insights as well. Just a couple of housekeeping notes I want to share before we begin. Like Angela said, please keep your microphones muted unless invited to speak. Please feel free to use the chat for questions, reflections, or just sharing your thoughts. And we want this to be a safe and respectful space. So please let's listen openly and kindly. So things you want to expect today will be you will start with a quick icebreaker today, then I'll introduce our lovely panelists and we'll dive into a panel discussion filled with so much insights where our panelists will share their experiences and insights on maternal health and early childhood development in their countries and beyond. And you'll also have the chance to ask questions and contribute your thoughts before we close with a reflection on what we have learned today. So we have actually planned a very quick icebreaker activity. So let's start with a quick reflection, and this is open to all GYAs. So imagine you or your close friend are expecting your first child, and you are excited but also anxious. You don't have easy access to healthcare, and you hear stories of mothers struggling to get medical help, and you worry, will my baby be safe? Will I be healthy enough to care for them? And will I have the resources to support their growth? So, to all GYAs, please take a moment and think about how that makes you feel. And once you have thought about this, please feel free to share one word or phrase in the chat, or feel free to open your mic and share what best captures your feelings right now after hearing this. Anxiety? Yeah. Yes, that's a very good one, Audrey. Concern? Definitely Shamanpreet. Yeah. Scared? Agreed. Lots of anxiety and feeling overwhelmed, for sure, Rose. And please feel free to unmute yourself if you would like to share something out loud. Uncertainty, definitely. Desire to change the situation, that's a very good one. Abandoned and lost in the system, definitely. It's not easy to be in that situation because at that time you're feeling anxious, you're scared, and you're overwhelmed. Worried, definitely. Stressed, yes. Yeah, thank you to all though for sharing these heartfelt words. And I see words like anxious, scared, overwhelmed coming up once again. And yeah, so would anyone like to share why they chose this word? And feel free to unmute yourself or just write in the chat. So why did you choose this word to express your feelings in the moment? I see overwhelmed with love and concern. Mohammed, do you wanna tell the GYAs why you chose these words to express your feelings in the moment? And this is open to anyone. Anyone can share how they're feeling the moment right now and why did they selected the words they put in the chat. I see I would feel worried thinking about any long-term consequences or effects for the child. Yes, I also see you would be scared and worried because there is a lot of uncertainty for sure. That's a very common theme we're seeing popping up once more. Sharon Preet says, I think motherhood is often treated an expectation over choice. Women are left to have children within systems that don't support them or their child because the focus is solely on the child being born. I agree. Lots of cultures really emphasize on having more children and raising families for women, even though if that means undermining and infringing upon women's rights. And we see, as for Lunacy says, as for me, I would be scared because others have bad experiences and I don't know what would happen to me. Yes, that's a lot of concern and uncertainty and anxiousness in the moment. Victoria says because the healthcare system is uncertain, and that's yes, that's a reality for a lot of countries around the world. And I chose uncertainty because everything is simply as sure as how the system should work for the child and the mother. Definitely. Audrey says I chose anxiety because it best expresses the feeling of worry, feeling helpless about a situation, worried, and knowing how to change the situation would best fit the description. Um, Edward says stress because I live in a country where access to healthcare is something very hard to get. Indeed, indeed. Yes, so thank you to all the GYAs. Thank you for your openness. And now let's just reflect together. So, what do you think would make this mother feel more secure? And what role do you think healthcare systems, policymakers, and communities should play in supporting maternal health? Please feel to share your thoughts and feelings in the chat, or feel free to unmute yourself to speak. More research into women's health. Yeah, I agree. I definitely agree, Sharon Preet. I think research is just such a deep and important component in maternal health, and definitely researchers do need to focus on this topic. And also, there's a lot of need for funding relating to this topic. And as we'll dive into the session today, we'll also talk about how their world is planning a campaign to solve this issue around the world. Elizabeth says provision of mobile clinics will go a long way. I agreed. I think mobile clinics are such an innovative way to tackle this issue. Aisha says policies that prioritize the health of the person giving birth as well as access to healthcare and medications for low income families. Yeah, definitely the subsidy component is so true. Muhammad says, I think this reminds me as how access to maternal care isn't just about health, but it's about dignity, safety, and justice for every mother and child. Beautifully said, Mohammed. Uh, Kenny says maternity is a germane part of humanity. Yes, indeed, and should be more policies, funding in particular to this. I agree with the funding part, definitely. Uh, I see some GI saying they should increase access to maternal health care and make sure every mother who's not able to afford will get it for free because this is something very important. Yes, it is very important. Audrey says availability of free healthcare to expected mothers. Yes. And I see being part of a safe and supportive environment can lessen the doubts and concerns for sure. And I see education on parenthood as something you are thrown into, essentially, no experience, often leading to postpartum depression with the shock to the system. Definitely, I think the PTSD component really is one to pay attention to. And finally, Rose says access to free and quality healthcare and emotional and social support and workplace and policy support as well. Yes, beautifully said too. Beautifully said. You guys did so well. And okay, we'll be moving on now, and we'll be diving into why is maternal health important in early years development. So to frame our discussion, um, maternal health is critical to early childhood development. It's a early child years start before birth, so access to immunizations, nutrition, and quality maternal care can prevent up to half of maternal and newborn complications, and it could help save lives and improve well-being as well. And this is a very crucial topic because this is a mother's body is the first environment a child knows. So investing in maternal health could really go a long way and to help promote economic growth, gender equality, and to raise healthy mothers, because healthy mothers raise healthier children, and children who learn, grow, and contribute to inclusive prosperity and society at large. And also talking about maternal mental health is essential because poor maternal mental health is linked to poorer child development, especially in disadvantaged communities. And just want to share that their world is aiming to work on this as well. So Their World is actually a co-leader of the Act for Early Years campaign, and it calls upon the government to invest at least 1 billion in new funding by 2028 to ensure universal access to early childhood support. So it includes affordable childcare for all families, parental support for both mothers and fathers, and also adopting a more holistic approach to maternal health. And with that being said, I'm excited to introduce our panelists for today, and we'll be diving into our panel discussion very shortly. Um, Unfortunately, Ilkana, one of our panelists, is unable to join us today, but we still have Jimo and Joanne on the call today. So, a lot of good things to talk about. And so, now I will call upon each panelist to introduce themselves briefly when I say their name. And please share your name, your role, and what maternal health means to you personally or professionally. So, first, Jimo from Nigeria. He's a pharmacist and also the founder of Mother and Child Health Foundation. So, Jimo, please share with us your work and how you're tackling this important issue.
Thank you so much, Caesar. Am I audible, please?
Yes, you are, Jimo.
Right, thank you so much, Caesar, and thank you so much to everyone that is present in this gathering and discussion because this is very much important and it's something I'm very passionate about when it comes to maternal, not just maternal health, maternal and child health, because it's always together. When we talk about maternal health, you can't completely remove child from it, right? So I'm Bolwatife Jimo. I'm from Nigeria. I'm a pharmacist and also the founder and executive director of Mother and Child Health Foundation in Nigeria. So basically what we do at Mother and Child Health Foundation is advocacy, research, health promotion. We raise awareness on maternal and child health towards mitigating maternal and child mortality rates. I'll be talking more about it during the panel session about our works and how everything connects with each other. But that's basically what we do because Nigeria is actually one of the countries with the highest maternal and child mortality rates. I have my own personal story which I'll be sharing along in the panel session, but let me just close it up for now. Thank you so much.
Thank you, Jimo. And next, I would invite Joanne from Zimbabwe. She's actually a medical student specializing in obstetrics and pediatrics. So, Joanne, please go ahead and introduce yourself.
Yes, my name is Joanne Shapiro from Zimbabwe. I am a medical student. I did some rotations in obstetrics, gynecology, and pediatrics, so that's where I learned more about maternal health and my interest developed. So I'm also part of a medical student association where I get to interact more with patients in this regard, and that's where some of my experiences that I'm going to share are going to come from. Thank you.
Thank you so much, Joanne. Thank you all for being here. And let's dive into our panel discussion today. So, to start, let's look at the barriers and cultural challenges in accessing maternal health care. So, Jimo, from your research, you focus a lot on maternal mental health in your work as a founder, and you have led campaigns focused on maternal mental health. So, please tell the GYAs what inspired you to focus on this and what has been the most powerful moment in your advocacy journey?
All right, thank you so much, Caesar. Okay, before I go ahead, just to make this a very because it's a discussion between the two waiting. So I know understand that we are on the side of the panel, but I want us to be have a discussion together. So I want it to be very interactive as well. So I'd like to ask everyone if they have or they know anyone that has died from childbirth or lost their child during childbirth, or know someone that has experienced pregnancy or childbirth trauma. You can just type yes or no about this question in the chat box. Let's just see. So we can just have like a data here. Yes. Okay. No. Okay. Yes. Okay. If we can get two more responses. Okay. Maiduguri, Nigeria. Okay. So basically, what I was trying to establish here is because of the fact that I just want us to know that when it comes to maternal and child, it is something very important and something we need to do a lot of advocacy on. You understand? Because not just beyond just the urban areas, there are some remote areas, rural areas where this information, essential information, can't reach. You understand? And if you look at what someone said in the chat box now, the Meduguri, Nigeria area, you understand? So basically, we need to understand that this is something very important. So, and what inspired me basically is the absence of the five A's. When I mean the five A's, I'm talking about availability, affordability, accessibility, acceptability, and adaptability of maternal and child health. So this is just like I'll call it like the umbrella of things that actually inspired me to what I'm doing for in terms of maternal and childhood. But beyond that, I also have a personal story of when my mother shared a traumatic experience she had during childbirth, which actually caused that ripple effect of me starting my foundation in 2022. And since then we've impacted the lives of over 2,000 women and children in Nigeria. So these five A's I'm talking about is availability, affordability, accessibility, acceptability, and adaptability. So in some cases, the community may not have available maternal and child health care or affordable. If when it's even available, it may not be affordable for the community people to, get access to it. So there's accessibility as well. So in some remote areas, you won't be able to like reach remote areas whereby I will say they need to like cross maybe two or three rivers before they can, or oceans before they can get access to this healthcare. And then acceptability. Sometimes you bring this healthcare to some communities, but because of traditional beliefs and cultural beliefs, religious beliefs, they don't accept it. You understand? And when it comes to adaptability, we have evolving technologies coming in, which is something we'll be talking about later on. SMS, AI integrated platforms, mobile technology coming in to provide access, maternal and childcare access. But there's still a bridge and a challenge where people are not able to like adapt to this change. You understand? So that's where our advocacy work comes in, making sure we bridge these gaps, making sure our maternal and child care is available in these communities, affordable as much as possible, accessible, acceptable, and affordable. And when it now comes to my the powerful moment I've experienced when it comes to maternal mental health, I would say is during our community programs where you know even a nurse and also the mother. So I'll talk about the mother first. So the mother acknowledged that she didn't know what she was experiencing was postpartum depression. So education is actually very essential. In She thought she was just being a bad mother to her child, so, or being just a bad person, but it's just those emotions and the mental states you at that time. So these community advocacy things are things that help women in this community understand themselves better and know how to like care for themselves, know how to like reach out for the care required for themselves as well. And beyond this, the nurse as well also shared her experience about our daughter-in-law, how she treated her, and then later on she, learned about those things she was doing there were just postpartum blues. And so these are powerful moments, I've experienced so far. Like there are many other moments, but these are just like highlights of moments I've experienced during our advocacy work.
Thank you, Jimmo, for sharing. And yes, the 5 A's are super important. And who can understand mothers better than mothers themselves? So thank you so much for sharing these insights. Now, next, I would like to go on to Joanne. As a medical student, what patient experiences I want to ask what might stand out to you about how culture and systemic issues affect maternal health access and outcomes in Zimbabwe?
Thank you. I think I'll mention two cases and then I'll ask the floor to also share some cases so that we can get a insight. As you must say, let's make it a discussion, not just a lecture-like session. So the first experience I had was in a attachment. We had a pregnant lady who went into labor and came to the hospital, leaving her son with her mining husband. So the husband was a minor, and in our culture, the woman is more responsible for taking care of the child. Now, with her being in the hospital to deliver the second born, the firstborn was initially left alone at home when the dad went to work, but then he realized he can't continue taking care of him. He thought it was just for a day. He's now in labor. She's going to leave and come back home tomorrow. And it so happened that the labor was progressing so slow that she ended up staying in the hospital longer. The husband came to the hospital, I think on the third day around 6 p.m., crying, asking the nurses to discharge his wife so that she can take care of the son. And we were trying to explain she's in labor and the labor is progressing slowly. If anything happens, that's an emergency. At least if she's here, we can help. But the husband didn't care about that. What he cared more about was who's going to take care of my firstborn son? I want to rest. I can do this. So unfortunately, we discharged the patient at her own will after she realized that the husband is actually struggling. She had now to put him above her own health, and then they went home. And it was quite an unfortunate situation for us to see that your partner who's supposed to be supporting you is actually the one who's trying to drag you through more misery when they're supposed to be supporting you, taking care of the other children, taking care of you, but they are the ones actually nagging and saying, fulfill your cultural duties as a woman. You're supposed to be a caregiver. I'm supposed to be a provider. I'm not supposed to be doing this. So it was quite sad. Unfortunately, we don't know what happened to the baby because they never came back. So whether she gave birth to a healthy baby, 4 year girl, we don't know. She never really came back. And I think the second experience that I experienced this year, this one really broke me. I actually called home crying. I was my first time in surgery on call, and this lady came with an 8-month-old boy who was sick, and she mentioned that she had recently separated from the father of the child, and the child was now at least a week was he's been sick. So asking why have you now come after a week? She was trying to explain it's been a struggle, having to separate from the dad and trying to go through that at the same time take care of him. I thought maybe he'll just get better. And he's my first child, so I don't know much about taking care of the child because she was away for the birth of the child and how he grew up. So whilst we were attending to the child, he just started having a fit. And then I told my seniors because I didn't know where the medication was. They delayed giving him the medication. And you know how they say when someone is dying, you have to feel their temperature turn from warm to cold. And I saw that happening right in front of me, seeing him turn from warm to cold, turning all rigid, and telling now the mom that we did all we could, and you lost your firstborn child, your only child actually, and it was her first time having a child, and she's already going through that depression of having the separation from the father because the father didn't want to take responsibility of the child. I remember after telling her, I left the room, I called home and started crying, thinking hard it is, or if it is so hard for me to process this, what more the mother what she's going through. So that really broke me. I don't think I'll ever forget this baby ever in my life. So I think those are the most two crucial experiences that I've experienced so far that incorporate cultural and systemic issues in terms of maternal health and childcare. And I'm be so happy if at least two other people can share their own experiences whether in the chat box or actually mute their mics from the audience.
Thank you, Joanne, for sharing this beautiful story, and it's truly emotional and definitely, if you felt so much pain, then how much that mother would have felt that pain, and it's just so sad to see the child being gone. And indeed, thanks so much for sharing your insights as a medical student. Going back to Jimo, I wanted to ask, how have you seen maternal mental health and child development intersect in the communities that you work with?
Yeah, thank you so much, Caesar. Yeah, I think when it comes to maternal health and child development, the connection is actually undeniable, right? So basically, like few weeks ago, I attended a conference where a psychologist, also a maternal and child health expert, she based on her research and she was presenting her research work. She emphasized on one particular thing in her practice, which is often done in some other practice, but something she changed in her practice based on research and studies is the fact that oftentimes when a woman has been diagnosed with a mental health condition, they usually, separate the child from the mother. And when we are talking about connection, this connection is undeniable. It should be established between the child and the mother. The child at that stage, of few days, few weeks after birth should not be completely separated from the mother. There should be, oftentimes there's a saying that um it takes a community to care for a child, but it takes a community and more to actually care for the mother. You understand? So in that case, the child shouldn't be separated from the mother. So let's look at the animal world. Okay, we humans we are higher animals, fine. But let's look at the animal world now. Look at birds. When they give birth, they hatch the egg, and even after hatching the egg, they don't just leave the chicks to just go on their own. They still create that warmth by sitting down, incubate, like sort of like an incubation. You understand? Similar thing in also humans as well. There's a level of body to body temperature the child should actually have with the mother. There's this technique called kangaroo technique. If you look at a kangaroo, you know that the kangaroo is always the child of kangaroo is always in the pouch of the kangaroo, the mother. You understand? So this technique is actually practiced in human setting as well. So in the case where the mother needs, like, there's some situation like called postpartum psychosis where the mother needs to like be separated from the child completely. You understand? So the kangaroo techniques are often practiced where or in the case where even not even mental health condition now, in the case where the mother was lost or died during childbirth. You understand? So this connection still needs to be established, maybe by a nurse, a doula, or a midwife. You understand? So the kangaroo technique is basically you having the child close to the body just to maintain that warmth, that body temperature that is required. You understand? Same thing also if you look at dogs and milk. If the dog gives birth to the puppy now, if the puppy doesn't have access to the milk, they probably going to die in few days, few weeks. You understand? So these connections are also like also can be seen in humans are where there's something we call colostrum, the first breast milk. You understand? The mother needs to give to the child. You understand? So in terms of maternal mental health now, if the mother is not present, if the mother is not available, absence of this warmth, for example, warmth and this milk that the breast milk contains antibodies, contains nutrients essential for the child development, the brain development of the child. You understand? So imagine a mother not being present for the child. because of this practice, you understand, separating the mother from the child because of a mental health condition, or the breast milk, this essential nutrients not being accessible or available for the child, is going to affect the brain development, which also affects, like, when we talk about brain development, we look at education, look at what we are doing in their world, ask for early years, you understand. So these are the things that are quite connected all together. So the mother needs to be present, basically. Mother needs to be present to provide this breast milk, this care, this love, this warmth, so that the child will develop properly. Is There's not going to be anything like nutrient deficiency or infectious disease in present absence of antibodies, or essential nutrients to just help the brain development and overall bone development itself. Yeah.
Really well said, Jimo. The breastfeeding part incredibly true. It has so many good antibodies and so helpful for mother and the child, both of them. And I truly agree with your point. It takes more than a village to raise a child and support maternal mental health as well. So thank you so much for sharing your thoughts. A follow-up question that I have is that please share what kind of creative initiatives have you come up with in your work that you do in maternal health, and how do you disseminate those tips and the campaign that you have led, and how effective have these been in reaching underserved women and mothers around the area that you're in?
Yeah, thank you so much, Caesar. So some initiatives, we during our community advocacy work, community outreaches, we often like create like a safe space. I highlighted before that a woman actually, spoke up. Since you have to create a safe space for people to be able to share their experience, share what they are going through. You understand? So we emphasize on creating safe spaces, and we do screenings as well to be able to identify women like early that are having symptoms of postpartum depression or postpartum blues or even postpartum psychosis. You understand? So that's one of the initiative. We also have a project we call Art for Our project. We started last year, basically where artists come, to showcase their art, to express um, maternal mental health and also other themes as well in regards to maternal health. You understand? But for this year, this project is going to be including um, a platform where mothers in the communities themselves will be able to paint on canvas what they are experiencing. So it's beyond just artists, showcasing their work in the exhibition. It's now mothers themselves expressing themselves, with art, paint, colors, how they are feeling exactly on canvas. Understand? And then they will also be able to talk to, like, a safe space as well, talk about what they've actually worked on that canvas as well. So that's one of the initiatives we are working on. And also some other initiatives, our partners, we work with our partners on is SMS based health tips, basically where we provide regular health tips, via online platforms, SMS, WhatsApp group chats. Sometimes we organize webinars, virtual webinars for people that have access to join, and basically just providing this information to keep them updated on the recent updates on knowledge. And for also just beyond even just the women in the community, we also make this information accessible to healthcare providers. You understand? So because we also need to emphasize the need for healthcare providers to know more and integrate maternal mental health in antenatal and postnatal care, right? So I would just like to give examples of some other initiatives in the country that are also like working on maternal mental health, which is actually very good. Is the integration of AI through WhatsApp-based. I don't know. I don't want to mention any company's name, but we have two people doing that in the country now in Nigeria, who are like integrating AI in WhatsApp, where if you just have access to a mobile phone or you have access to WhatsApp, you understand, and you have the contact, you can easily just type, what is going on, what you're experiencing, and you can just get information about it right from there.
Very well said, Jimo. I think AI is here to stay and it's going to stay here for a long time. So it's best we make use of it for the better. And now going back to Joanne. So please tell us, how can healthcare systems and youth advocates better address maternal mental health given the cultural stigmas around postpartum depression?
Thank you for the question. Like Jima said, it takes a community to raise a child and even much more to help maternal patients. So I believe that this will be a multidisciplinary approach, really. All doctors, nurses, midwiferys, those, what do you call it, public figures, female public figures people look up to can all assist in overcoming the stigma surrounding postpartum depression. We have sessions that we have in Zimbabwe where the mother comes almost every 2 weeks, 6 weeks, where she's taught about what to expect throughout the pregnancy. I think as well in those sessions on the doctor's side, if they now include patient education on postpartum depression to help them that when they then go through it, they can notice it. And then during the postpartum period, we have 6 weeks which we follow up on the mother. In those 6 weeks, we can also continue to screen for postpartum depression and provide help. And then with respect to the community, they can assist by having, as Juma said, maternal groups which they meet up, they discuss so that they know they're not alone. Knowing that someone else is going through what you're going through helps you go through it better. So having those sessions in terms of the community, it would help them understand that it's normal to be going through this and I can actually overcome it. Hearing out someone else's story of overcoming it. And like Juno said, it's very important for the baby to have breastfeeding in those first 6 months. And imagine now if the mother is going through postpartum depression, the more she sees the child, the more postpartum depression is triggered, which leads to the child growing up underdeveloped, and that also impacts the child's education level as they grow up, because those 6 months are very crucial in them developing up to being um, healthy children who are more effective in contributing to the community. And I believe people can also use social media. After all, we're living in a technology era. We can request public figures which people look up to create short TikToks in which they educate the public about it, and go on radio and TV adverts to broaden the scope in affecting everyone. Going into schools, on our side, we've been seeing a rise in teenage pregnancies. So going in schools and actually giving those children an education about what postpartum depression is, and trying, of course, to prevent them from getting pregnant as teenagers would help in reducing the postpartum depression as well as maternity mortality rates. Thank you.
Beautifully said, Joanne. I think it is so important to use social media for the greater good, and if we could really create these, focus groups, these support groups for mothers from around the world to help them educate better, especially if they're teens who are pregnant and are unsure of how to care for their child. I think you really touched upon really great points there, Joanne. And so, just a follow up question I have for you. As a young medical professional, what role do you see yourself and other young medical professionals play in bridging the gap between traditional beliefs and modern maternal healthcare practices?
Thank you. I believe as students, we can start with patient education. With every first contact you get with the patient, it's important to also explain to them that these things exist, these things are real, and if they can bring their partners, it's even greater that at least not just the patient will understand that there's such a thing as postpartum depression, as well as if their partner understands. Like in the first situation I shared where the husband was more concerned about himself, if they also come for these sessions and understand that even after delivery, your wife might go through postpartum depression, she may not even be able to continue to take care of the first child. We need to be there to support them. It would be more imperative for them to learn these things as husbands, as partners, so that they can provide good social support to their wives when they're going through the pregnancy, postpartum period, or ever going through depression.
Yes, indeed. Thank you so much for sharing your insights. I really like to point that we should involve not only the mothers but also the fathers because maternal health is as equal as, important as paternal health as well. So thank you so much, Joanne, for bringing that up. Going back to Jimo, from a policy perspective, what urgent policy changes do you think does Nigeria need to improve maternal and early childhood health? And what do you think? How can young people help push these changes in the broader community?
Yeah. Thank you so much, Shiza. So what we are doing here, first of all, this discussion we are having is a step towards change. Like, young people coming together, GYs, I'm from Nigeria, um, Joanne is from Zimbabwe. We have people from various parts of the world coming together to, have this discussion, to see the reason why this is important, to see, how we can make this better in our communities. It's just a step towards that change we want to make. So this is one of the things young people can drive, to make to create change, having focus group, discussion groups, and also community advocacy as well. Young people coming together, organizing outreaches, going to communities, speaking with women about raising awareness about these things in the communities, in the marketplaces. And these are things young people can actually do to create change, right? Because when I started my organization, it was just a project, right? It's just more than a child project. But now we've grown to become an NGO, a foundation in the country, because we've seen our vision is actually very broad, is to build a world where every mother and child are living healthily and have quality lives. So that's that on what young people can do. When it comes to policy, I think we need to prioritize community-based mental health services, maternal mental health services, especially in the sense that we need to create safe spaces. Like, there is always this stigma around mental health. When it comes to pregnancy, it's not always easy for pregnant women to just say she's experiencing this, and there is a look that comes on um the faces of people when you tell them that you are, they'll be like, oh, sorry to use this word, but like, oh, she's mad or something like that. But when we create safe spaces, we let people know that these things are just are things that may happen, during pregnancy, after pregnancy, and weeks after pregnancy. It creates like a sense of like understanding, you understand? So prioritizing community-based maternal mental health services is very important, right? To create safe spaces and so to reduce the stigma as well. So we also need to look at provision of free maternal care. I think one of the GYAs actually mentioned that in the beginning when we were talking about what we can do, right? So free maternal care services, or almost discount, like almost free, you understand, maternal health services. Because I know some countries are actually still, underdeveloped, and we need to look at these things, but we can actually work towards, creating change, just like what the Ask for Early Years agenda is about, providing better maternal health services and childhood development and these things. So people coming together to contribute to this campaign, we help make services like this free in communities like underserved communities, underprivileged communities. And we also need to look at wash infrastructures, building of wash infrastructures in community. When I mean wash infrastructure, the full meaning of wash is water access, sanitation, and hygiene. And this is for children basically, and adolescents. And most times, infectious diseases when it comes to child mortality, is always tied to child mortality, such like diarrhea and the likes. So if we have proper water access, clean water, we have proper sanitation and hygiene, education, and infrastructures in the communities, we'll be able to reduce child mortality rate. And also, if young girls also have access to wash materials such as sanitary pads, we also be able to reduce school absenteeism. So we have young girls going to school because they have these essential materials. And also, um mental health screening should be integrated into antenatal. I think I mentioned that earlier on, and postnatal care. So we need to also like work with healthcare providers. It's a collaborative thing. We need to work with healthcare providers for early detection, counseling, and care for the mother. So I think these things are policies that are needed, especially in Nigeria. But I also like to engage the GYEs to just type in the chat box what policy you think should be, made change, or policy change you want to see in your country. Okay, so yeah, just type in the policy change you want to see in your country. Yeah, creating safe spaces for mental health, yes. Free or almost free maternal health services. Yeah, okay, that was what I mentioned. Thank you, Kehinde. So let's type in the chat box what that urgent policy change you want to see in your country as well when it comes to maternal mental health. Cheaper childcare, yes.
I think someone previously mentioned about having paternal leave, increased paternal leave. Do you want to share more on that,
Yes,
please? You can
yes.
unmute yourself and share more on that.
All right. So I would just like to also share on that as well, if the person is not on meeting. So yeah, that's also something that needs to be a policy that needs to be incorporated. When it comes to maternal leaves, so some companies may actually give you the maternal leave, but it may not be paid leave. I wanted to try and understand that. So there are like three scenarios. Some companies will not give you the maternal leave at all. While some will give you the maternal leave where okay, you can go, but we won't pay you. And then there are situations where um the maternal leave is given and then you're actually paid for that period you are absent from work. So these are things that also need to be like, incorporated in the policy change as well, where every institution, every organizations is mandatory that they actually have the maternity leave in their structure. And it's not just having it, also ensuring that they also provide that wages that are required for that period where the mother won't be at work, and also creating a safe space for the mother at work as well. So when I mean safe space for mothers with children, there are still, let's say, um uh there's this, I don't know, there's this word now, this crèche, or mothers with still little children, you understand, that they're still required to bring their children to work at that point. So creating a safe space in the office space as well is very important, and it's something we should also work on, incorporating in policy change as well in the country and beyond just Nigeria as well.
Very well said, Jimo, and thank you to all the GYAs who engaged in this meaningful interactive activity. Lots of great points about, really prioritizing maternal and paternal leave equally, providing subsidies and cheaper daycares. So all of those are really great points. And now I would like to move to Joanne. Please tell us how access to transportation can really transform maternal healthcare in rural areas. And please tell us how do these systems and transportation in particular relates to the 3-day delays model in maternal health?
Thank you for the question. Can I share my screen so that I don't have to say much about third delay? I think I have a picture which shows um third delay model. Yeah. So that's the third delay model. The first delay is the delay in the mother seeking help. The second is the issue of transportation, which is reaching the facility. And the third one is receiving care once at the facility, whether it's due to resources or due to other reasons. So when we started the session during the icebreaker, I think at that moment you mentioned something about difficulty in accessing help. I don't know if he or she is comfortable enough to first tell us why healthcare is difficult to access based off these three delays if they're open to saying something before I continue. I don't know if they want to use the chat box or they want to unmute their mic.
I think we can go on, Joanne. Perhaps they're not able to unmute.
Oh, okay, so just well, I said the question is, in your respective countries, can you give experiences which affect mothers accessing healthcare, depending on these three options? Whether the main issue is on option one, where they delay in actually coming to seek help, or is also in part two, where they lack transportation to get to the hospital, or it's on three, where there are limited resources at the hospital which they go to receive help. Of the three, which one is the major contributor to maternal mortality rates and delays in your country?
Is it okay if I can answer the question?
Sorry?
Is it okay if I can answer the question?
Yes, it's okay.
Okay. I personally come from Uganda and kind of like experiencing like because there's a shift in rural areas and in urban areas. Because in Uganda, I would say the facilities to get to the hospital. Because there's a lot of like because the villages don't have like very good hospitals or like healthcare services to the point that mothers always, have to like deliver their kids from home. Like there's a lot to unpack. There are very many like circumstances they face, particularly when they're, giving birth and they don't have, they can't afford to pay for, they can't afford to pay for like delivering a baby. They can't afford to like get to the hospital. Like it's a lot, but I feel like it's with the transportation because even when they scan that they expect the mother to deliver within this couple of days, you're not 100% guaranteed that this very day that the mother will be able to give birth. So not knowing something that is exact and also like having the challenge of getting to the hospital on time if that moment that's the right moment. And even when you get to the hospital, not being able to get the healthcare services you need. In some cases that if if someone was going to give birth, but then like they have like the is it called that that the umbilical cord, like that long string when it's like tied around the neck, then it offers, the healthcare workers to like get more like other ways of giving birth, like taking like a C-section or things like that. So you find that mothers have a really big challenge if they like, let's say like the natural way of giving birth fails, and when they have to like extend some certain services, like say like the mother has a fat baby and they cannot, take the natural approach to give birth. So it's more of like the transportation is a really big problem. And then also even the services you receive at the respected hospital in the villages, it's really calling like for, you know, better services, more trained people. Because in the villages, that's where you find that there are hospitals, but you have to like ask the natives to make sure that this is an actual hospital, if that makes sense. But yeah, so I feel like yeah, the transportation is a really big deal. When mothers have to like walk very long distances, like it's a lot that comes in, and then with that, even when they get there, they don't get the exact same like the services they have to receive, be it with the funding, be it with the injection, like everything. Like I wouldn't say it's one specific problem, but it's a couple problems that make the issue profound and calling and wanting to like, oh, what where should we touch to like reduce the stigma around this? Yeah, if that answers the question.
Oh, thank you, William. I'm seeing Noor and others are also raising their hands. Do you wanna unmute your mics, any one of you?
Hello, everyone. Hi, my name is Noor, and I am from Kenya. Actually, almost a friend, my fellow GOA from Uganda. I think he said most of the things that we are also struggling with here in Kenya. There's still a lack of access, transport, like transportation access, and also lack of, limited resources, like even the drugs, the medications that are supposed to help mothers during the pregnancy period, or even, accessing when there's emergency when they are pregnant is the main problem. The issue is, I feel like it's an issue of neglect, where the government neglects the people who live in rural sectors, and yet I believe the rural sectors is one of the sectors that also contributes to the growth of economies in every country. And yet most of the time, in terms of healthcare, they're neglected. There's no proper supply, there's no proper transportation, and even no proper, qualified doctors within the villages. So a lot of women end up being some even lose their life a lot, and that statistics actually, that particular data is it goes it goes unrecorded. It's not it doesn't get to be recorded because it's in the village, and the death keeps happening and no one cares about it unless someone, you know even if you care, it's multiple villages. For example, I am talking this from an experience myself, of something I have encountered severally. So the problem is the neglect from the government not prioritizing the entire maternal health care in the rural sectors. That's the main issue that we have. The problem is they are funding maybe the hospitals that are in the cities, in the cities that are more developed. Uh, Let me say, basically, the rural people are treated as if they are not part of the country, which is very sad and very unfortunate as well. So that's the issue. And I say the biggest issue is actually neglect from the government. Yeah. Thank you.
Thank you. Others, do you still want to share?
I see a hand up from Egypt, so if you want to jump in, please go ahead.
Yes. Hello, are you guys getting me? Thank you. Well, I'll say here in the country, I'm from South Sudan, and I'll say three of them are both, because you find that first of all, uh, having access to, you find that most women and girls who live in the rural areas in the city are illiterate, and they are not aware of um, that they should get help as mothers, and they find it hard to know that as a mother you have access to maternal health, and you have the chance and access to be able to go to the hospitals and access medical care. And then also the transportation, and that in most villages, even one healthcare center is not there. You walk for miles and miles and miles and you don't find. So it's very hard. And once they get a chance to be able to go to the hospital, you find that the women and girls end up being traumatized or even stressed out, because you find that the nurses and the doctors there, some of them are not well trained, and you find that they be rude to them. If, for example, you're a young girl and you're pregnant and you want to give birth, they'll be like, why aren't you at school even? What happened? Why did you have to get pregnant at this age? And yet it's not the girl's fault. Sometimes you find that most girls in most communities here, girls are married off at an early age, and so you find an 18-year-old or even younger than that, 15-year-old carrying a child and going to the hospital. So it's really very hard for
most women and young girls who are pregnant and who want to give birth. And I believe that they all have the rights to access to healthcare, and it should really be prioritized. Yeah, thank you.
Yeah, thank you so much to Noor, Edith, and William for jumping in to this important conversation. Thank you, Joanne, for your very well said answer. And a while back ago, on the chat, I saw one of the GYAs point out that women are more likely to be told that their symptoms are not real by doctors, and they're more likely and more less likely to be treated properly and on time when compared to men. And I think I just want to talk about this for a while. I think this is such an important issue that one of the GYAs has brought up, because a lot of women are not in the medical professional, and if they are in healthcare, then they are mostly nurses. But a lot of doctors are in the mainstream services are mostly men. So this is a really prominent concern because it really intersects and overlaps with maternal mental health and the child's well-being. So if anyone wants to jump in on this discussion, please go ahead. And this is open to all the GYEs and both of our panelists as well.
I just wanted to say thank you to everyone who contributed to my question. I just wanted it to be an interactive one. And then answering the question that has been brought up, I think, yeah, that's very true. Most doctors are males. All of my consultants are actually males. The doctors that actually teach me are all males. I believe it's an issue of culture, like we mentioned before. You don't have much time to pursue your education to a higher level because you have to take care of your children, take care of your husband. You're now more focused on being a housewife or a mother, such that you don't have time for yourself, for your personal growth, because you're carrying other people for them to succeed, so that you yourself cannot go much further, like others. So the highest level you can go would be becoming a nurse because it's a shorter course, so that you have more time as well to take care of your family.
Yeah. Hi. My name is Will. I think it's a very big stereotype that we face in Africa, whereby men have a bigger platform, and there's a lot of expectations because I was actually talking with my grandfather the other day about the stereotypes we have in Africa. As a male child, they tell you, oh, who heads the family. There's certain things. Yeah, you're put in they put you in a category of, like, as a male child, you have to be the head of the family. You have to work really hard for your family and all that. And then my grandmother was telling me that as females, they grew up with the intentions like, oh, you have to just get married and have kids and be a teacher, be a nurse. Like, that's what society expects of you. But I had the chance to come here in the US, and things drastically changed, right? From the point of seeing, like, because here in the US, like, it's it's a like a land of opportunity whereby everyone has the same rights and the power to, like, do whatever they can in their aspects, right? So I feel like in Africa, it's more of like a thing that whereby women can, you know, audibly, come out to say like, oh, this is what, I think about this because yeah, it's true that majority of doctors are male because that's what society expects, that oh, the males are more knowledgeable, they're more confident, they're more like compelling, you want to like always reach out to them for like advice and things like that. So it's a very big stereotype, and that kind of like let the females goes back to like, oh, I can be a doctor, well, I think I'll fail my exam. I think I'll fail my rotation. Like, it's a lot, but that's because of, like, the environments we grow in, and where they show you, oh, women, are limited to these resources, and even no one might be willing to, support you throughout the journey. So yeah, I would say it's it's a very big stigma that when ladies when they access hospitals in Africa, they're less likely to get help just because that they don't expect them to have their own money. They don't expect them to pay for services, and there's a lot to because they're always like, oh, the problem seekers, they always have problems, they're the ones, like they're always the people who are seen in the wrong. And I feel like that's an issue we should always like talk about and raise concerns about it, because mental health is a real thing. Because me in Africa, I used to think that mental health didn't exist, to be honest. Like, like, oh, because you're just in a routine, go to school, go home, play with friends. Like, there's no that space to actually talk about things that really matter, things that you care about. But though this was when I came to the US and found that, oh, mental health is a thing and we should actually talk about it. You know, women, have their rights and men have their own rights. And, it's a it's a very big topic to, to keep out there and keep talking about it and like raise awareness about it, because people are dying. And if you look at the stats, that there are more women than men on this planet. So we should actually conserve more, because women are more likely to increase the population than men. Because men, like, we're pretty much a dead end, because you can only do so much, but the women, they get to like, reproduce and, carry babies, and which helps to like grow the entire population. So I feel like there's a lot to, wrap around how women's mental health should be prioritized and talked about. Yeah.
Thank you, William, for sharing that. I see Chiara has her hand up, so please go ahead and share your insights.
Thank you. Yeah, I'm just thinking I come from a very different cultural context. So I'm living in Ireland where maternal mortality is not really something that we think about or comes up when someone gets pregnant. We don't really think about that often. But when it does, it's often that actually women are like much older than our usual childbearing age, because in Ireland our rates of first motherhood are increasing quite rapidly. Um, so I think that's very interesting. But then I was Googling it there to be like, well, how prevalent is maternal mortality in statistics? And one of the things that came up for Ireland is that a third of maternal deaths are from suicide. So in Ireland, that mental health thing is so it's so like equivalent to that physical health thing in terms of its impact on death, and that's really shocking. But I think one of the things then that comes in where we're talking about the overlap and the I suppose like kind of shared situation is that idea of the women taking on all of the home duties. So in a lot of other countries, it means that they don't have financial independence, and that has a massive issue on mental health, risk of violence, etc. In Ireland, it's often that they do have a job and they work a 40-hour week, and then they also do 30 hours of childcare on top of that, and we call that like a second shift idea. So I think it's really interesting where like the healthcare side of it is not something that comes into it quite so much, but then the idea in my cultural context, but then the idea that women have to take on all of the burden of childcare is very consistent across all cultural contexts. So I wonder if there's um I don't know, I'm interested in that juxtaposition and seeing how that works. So I've really enjoyed the conversation. Thank you to everyone for participating.
Thank you, Kiara, for sharing your thoughts. And I think it's incredibly beautiful that you talked about the cultural context and how they vary from region to region, because not all experiences are the same for everyone around the world. And with that, I see Rose has her hand up. So please go ahead, Rose, and talk about your insights as well.
Hello everyone, my name is Rose. I'm from South Africa, and I feel that as we were talking about feeling safe and seen, I feel there's a big stigma around asking for help, especially with women and men. I feel that in the context of health when it comes to maternity, a lot of women struggle to open up about what they're going through, and in turn, it results in a lot of more emotional, physical strain to the mother as time goes on. And even with men in general, we have conditioned men to be in this masculine front where they cannot be safe and provide a safe space for their wives or their children. So in turn, we're not giving our women and men enough space and safety to just number one ask for assistance when it comes to anything related to their child bearing journey, and also to just um receive access to resources, if I can put it in that sense. But thank you.
Thank you so much for sharing your insights. I agree with your points, and having that proper maternal support is such incredible opportunity for all mothers, especially when, the first environment a child knows is the mother. So having those supportive systems and communal support is incredibly important. So thank you for all of you who shared your insights with us and shared your own experiences and cultural context. And the floor is open to any further questions or comments. So feel free to write them in the chat or raise your hand to ask your question or comment directly to the panelist. And keeping in mind we have only 5 minutes, so please ensure that if you have a really pressing question that you would like to ask, please do so now.
I have a question. I think, yeah, this goes to the panelists. You know, the healthcare field is a very, very broad field. What are some of your been like your encounters when you're trying to, because the other day I was doing a research project on how like religion, religious beliefs, how they affect healthcare. So, as healthcare providers or as people who are really passionate about healthcare, what are some of, how has like faith or religion, been, come in contact, or like how have, certain beliefs, amongst different people affected how you're gonna, te like help teach others, or like how has that like affected like maternal health care, in the sense of that, certain people have like certain beliefs and they're very niche to how like they view their life. So how has that, some of people's ways of life come in encounter with you trying to show them what the right thing, or like help them to see the right thing?
Yeah, we're in the last 5 minutes of our session, so panelists, Jimo, Joanne, feel free to jump in, but please make it brief.
Yeah. Thank you so
Okay.
much, William.
Um.
Okay. Do you want to go first, Joanne?
Okay, you can go.
All right, thank you. Thank you so much for that. That's actually a very important question because it actually has religious belief, cultural beliefs has a lot of impact on healthcare, especially maternal care, healthcare and childcare, because there is actually a particular religion in our country that does not support women going through CS operation or any sort of even if it's to sedate someone or maybe for a period of time, or does not even like support that kind of situation. And if you look at the context, like emergency situation, and that is life and death, they will just it's about decision, the family person that will have to sign the consent. If you're a healthcare provider, you know what I'm talking about. So they will just have to. It's a painful scenario that if you have worked in settings, I don't want to mention in particular religion here because of, but if you've worked in some in healthcare settings in Nigeria, you will know this particular, people I'm talking about. It's so sad to see that, people, despite the whole, 21st century, a lot of awareness being done, people are still taking these things not serious. You understand? And down to traditional beliefs as well. We have some people that will refuse to go to where there's actually proper care. This is just beyond affordability now. But because of what they grew up with, the mindset they grew up with, that it has to be done traditionally with herbs and, I'm a pharmacist. I know about herbal medicine. I don't have anything against herbal medicine. But when we talk about people that are not licensed or don't have proper knowledge on these things, having to care for them and do things, and oftentimes it leads to complications, which will now require them to refer them to like tertiary institutions for proper care. So thank you very much, Williams, for that question. It's something very serious and has a lot of impact when it comes to maternal and child care. Joanne, you can go ahead.
I believe you said almost everything. What I just wanted to add was when we used to go for outreaches, there are certain religions which don't believe in having medical aids, seeking healthcare, so they would refuse us just talking to them about healthcare and would believe that um all will go well, we'll be safe, we don't need this healthcare system that you're trying to provide. People back then lived without it, so can we now. So some people actually suffer because of that, and it's quite unfortunate. And it's something like William says we need to look into and research more in how we can bridge religion in healthcare seeking behaviors. Thank you.
Just to add a little bit more to what the two panelists have said, and also William to share some of the experiences I've heard from people. I don't know, if you're not a Christian, you might not really understand this term, but within Christianity, they usually refer to women as giving birth as the Hebrew women, which is like a natural way of birth. And some people take this literally to the wordings of it, giving birth as a Hebrew woman, natural birth. And most of the time, that belief, in quotes, keeps women from accessing, especially pregnant women, from accessing the right medical treatment that they need. For instance, when you have a breech birth, when you have preeclampsia and all of those issues around pregnancy, in some cases, or even when you've got a high blood pressure and you are in labor, you are not allowed to be induced. You are not allowed to push out a baby with your own strength, because when you've got a high blood pressure, that amounts to a higher risk of you dying and not being able to like take care of your child once it is born. So the easiest and the safest means is for you to go through a cesarean session. And most times in most communities, in most beliefs, they don't believe that women who give birth through cesarean section are to be called women. So that is a cultural thing, that is a religious thing, that is something that really impacts on women's ability to make decisions, and especially not just on women, because most times partners on their own also see if, for instance, their wife gives birth through cesarean section, they are not so proud to talk about that with other people because they feel like, oh, she is not strong enough to push out a baby. And this is what we need to really, really talk about, because so many lives have been lost through this. And that's where awareness comes in. And you can also imagine having to have a child, maternal death, and you've got a newborn baby, and you could really understand how important that first stage of breast milk is really, really, really crucial to every child's development. And that is happening. And you can start imagining, what would that child turn out to be within such community, within such belief, that most probably when they grow up, that will be impacted into them to say, oh, you are not allowed to go through cesarean section. So these are things that most of the time we have to really look into. And awareness begins from us. It begins from us speaking about this. It starts from us, talking about it within our own community, even with our great grandparents, if they're still alive, our grandparents, if they're still there. Speak about this, because most times when you don't tell them that God has given us the brain to think as people, and that's why He was able to give us that opportunity to identify cesarean section as an option for women, to be able to have that child, to be able to have that joy that they want in their life or in their family. It might not be really well received, but yeah, I'm going to stop there and hand over to Shiza to continue. Thank you.
Thank you, Angela. Very well said. And yes, maternal mental health has many facets to it. It's a very comprised of, multiple intersecting identities. So no experience is the same for one. And so thank you to all the panelists, GYAs, Angela. Thank you so much for sharing your insights, your thoughts, and your own experiences. So as we wrap up today's session, I invite all GYAs to reflect and share one key takeaway from today's session in a word. So you can write it in the chat or speak it out loud. So please do so. And as we close up today's session, also think about, what changes would you like to see in maternal health policies and the broader community support available for mothers around the world. And thank you so much to everyone who joined this vital conversation today. And remember that improving maternal health is about equity, justice, and building a better future for all families. So let's please keep this momentum going. And thank you so much for sharing that. And yeah, thank you so much for sharing the takeaways on the chat. I see value of communities for a mother after birth, and I see there is no health without mental health, which is so true. Uh, and I also see maternal health care and maternal, it should be universal. So yes, talking about the universal access, as our panelists mentioned today, is incredibly important as well. And with that, the session is completed for today. And thank you so much, GYAs. And please make sure to stay connected on social media with one another using the LinkedIn platform. And you can feel free to, put your LinkedIn at on the chat as well. So thank you so much for coming in today, guys.